the Alabama people, okay? What's Governor Bentley got against the business community and jobs in Alabama? And more importantly, what's Governor Bentley got against the health of Alabama citizens? Shame on you, Governor Bentley. I'm Edward Savella with Progressive Democrats of America here in Alabama. I'm flanked by Anthony Allen Johnson, Reverend Anthony Allen Johnson, who's going to do some talking, and Scott Douglas from Greater Birmingham Ministries, Grayson Brown, also with Progressive Democrats of America. And I'm going to turn this over to Anthony right now. Thank you.
Governor Robert Bentley is the new George Wallace of our time. In the same manner that Governor Wallace stood in the way of integration, Governor Bentley is standing in the way of progress for all Alabamians. In the midst of a recovering economy and at the heels of a government shutdown, Governor Bentley is blocking federal funds from helping Alabamians, black, white, yellow, red, and brown. He's preventing us from help that would help our seniors who have made great sacrifices, to our veterans who have served our country well during peace and wartime, and all Alabamians who are already suffering, who are already without health care and health insurance. Our energy care fund is in jeopardy. The Cooper Green under attack. Health care in Alabama was already on life support, but Governor Bentley just pulled the plug. Amen. Let me be absolutely clear. This is not a partisan issue. Republicans and Tea Party members should be angry and up in arms, and that's Governor Bentley's party. But his recent decision to block the expansion of Medicaid affects us all. And for even more clarity, let us remember that however we feel about President Obama is the president of us all. Governor Bentley's refusal to accept Medicaid funds is costing Alabama businesses billions of dollars, costing at least 30,000 jobs, and is cruelly denying health coverage to Alabama citizens. Tea Party candidate for Idaho's House of Representatives, Greg Collette, on one hand, said that he doesn't think the government should be involved in health care or health insurance, yet on another setting admits to participating in Obamacare, also known as the Affordable Health Care Act, stating, and I quote, "Yes, I participate in government programs of which I adamantly oppose." Go figure. I participate in government programs so that I can take care of my family, end quote. I'm here to tell you today that there is a special place in hell for people who deny the basic and civil right of access to stable quality of life resources. I heard a preacher say that living in hell must be like living in a black box, chasing a black cat, and the cat is not in the box. So I say today, my brothers and my sisters, that we will overcome. Governor Robert Bentley, shame on yourself. You are our modern day Governor George Wallace, but we know that if we all stand together and if we have God on our side, that we will and we shall overcome. Thank you and God bless.
Amen.
I'm Scott Douglas, Executive Director of Greater Birmingham Ministries. Healthcare for all, especially the least of these, has been addressed by someone far greater than Governor Bentley or President Obama. And he had this to say: "Then they also will answer, saying, Lord, when did we see you hungry or thirsty or a stranger, or naked or sick, or in prison, and did not minister to you? Then he will answer them, saying, Truly I say to you, as you did not do it to one of the least of these, you did not do it to me." We're asking Governor Bentley to live up to his elected office and his faith, and doing the right thing for all the people of Alabama, especially the working poor. In 2011, remember, the Alabama legislature passed and Governor Bentley signed into law an act entitled the Alabama Job Creation and Taxpayer Protection Act. The name of that act was a lie. That act was really the anti-immigrant bill that was fueled by hate and passed by political opportunism. Today, the governor is refusing Medicaid expansion. Yet another misstep, fueled by hate, and this time denied because of political opportunism. But Dr. Martin Luther King said, in this city, the time is always right to do right. Governor Bentley said Alabama will not expand Medicaid under the current structure. King was right and Governor Bentley is wrong, dead wrong. It's time for Governor Bentley to minister to the sick, to minister to the least of these, the rest of us. And the time is always right to do right. For real job creation and taxpayer protection, there's something the governor can do. Medicaid expansion is the right thing to do now. Now's the right time to do it. Alabama's working families need it, and that should be reason enough. If the governor refuses to act, thousands of our poorest residents will lack affordable health care coverage, while people with more income will get help with their premium. Alabama will leave nearly $12 billion in federal health care dollars on the table over the first 7 years of full ACA implementation and forfeit an overall economic benefit of $20 billion. That's as big as the Airbus, no bigger. Alabama cannot afford to leave that much money on the table. Other parts of ACA will go into effect in Alabama on January 1st, including the state-based health insurance exchanges. The important thing is residents of other states will get a better return on their federal tax dollar than Alabama. And up in Kentucky, they're already saying, thank God for Alabama. We'll be subsidizing Kentucky's health care. For us in Jefferson County, as Reverend Johnson mentioned, health care has already been severely damaged by the willful political destruction of Cooper Green. So for a healthy Alabama, expand Medicaid. For a more prosperous Alabama, expand Medicaid. And for an Alabama that values working families, Governor Bentley, expand Medicaid.
My name is Grayson Brown. I'm with the Progressive Democrats of America. I'm kind of the numbers guy, and I'm going to flesh out a little bit more on the numbers that we're talking about here. We have two studies about the effects of expanding Obamacare in Alabama. One is done by UAB and the other is by University of Alabama. Both of them are very current. The latest one is from the University of Alabama. It was done in September 2013. In summary, what you've got is if Governor Bentley would expand Medicare for the period 2014 to 2020, the state would have a $28 billion increase in overall business activity. On a yearly basis, we would increase 30,000 jobs. 300,000 would get health care under Medicaid if you just signed the bill. This seems like it's a good deal for Alabama. Now, what does Governor Bentley say? Well, what he says is the numbers out of the University of Alabama are bogus. But he has not presented another study to show what his basis is. And I call on the governor to produce your study, produce your experts. If you have anything to disagree with the University of Alabama about on that, we want to hear it. In fact, I'd like to hear it on prime time. Let the experts debate this. Because the situation that we have here is that people need to open their eyes as to the facts. What will happen if we accept expansion of Medicaid? If we don't, we've had the speakers tell you the problems. One of the situations that really concerns me is that in Birmingham, we are a healthcare center. Healthcare drives our economy. Governor Bentley is taken really about to healthcare, not just in Birmingham, but the whole state. Hospitals depend on payments from the federal government for care of the indigent. Under the situation, we are going to get reduced payments, actually in the amount of $1 billion from 2014 to 2020. So we're losing money because Governor Bentley will not accept the Medicaid revenue that would come into the state. We'll get it both ways. And hospitals, a lot of hospitals in Alabama are on a close, really close edge to be able to keep to stay afloat. So the situation is very dangerous. I believe it's 11.7 billion in Medicaid dollars, federal dollars would come into the state, and that is projected to, like I said, increase the overall business in Alabama by 28 billion. So, in summary, this is government malpractice. I call on Governor Bentley to obtain a government malpractice insurance policy for $28 billion to cover us.
Thank you. I'll just say that what you're seeing here is an embryonic genesis of a movement that's coming after government malpractice by Governor Bentley. So we will hold a rally here. I believe it's on November 29th. It's between Thanksgiving and the Iron Bowl, and we are building a movement that Governor Bentley will not be able to escape. We're going to call him on the carpet on this. Alabama is going to join the rest of the civilized world in health care.
Mr. Salvo, I take it you
Sabella.
don't... Sabella.
Rhymes with umbrella.
Mr. Sabella, I take it you do not believe that Governor Bentley, when he says that Alabama cannot afford the expansion through the match $1 million.
This is borne out by studies by universities, by the facts. This is part of an overall. Let's not let Obama's programs succeed. We in the democratized, advanced economies, we are the only country that doesn't provide universal health care for its citizens. Governor Bentley, what is the matter with you? Why do you not? Governor Bentley, why are you so against your own citizens, the health care of your own citizens? This is a law of the land. Join the program.
Can I respond to that too?
Yes, sir. Go ahead.
Okay, the cost to Alabama would be $770 million under the expanded Medicaid. We're talking about increased business activity of $28 billion. The taxes that would be paid in Alabama would be more than $700 billion. So the increased business results in taxation and will pay for it. So he's wrong. And the basis of what I'm saying is studies out of UAB and the University of Alabama.
It's a net profit of $935 million over 7 years. And in the first 3 years, when the federal government pays 100% of the costs, we net profit $212 million per year that will go into the education fund, because it's it's sales taxes and income taxes from all those 30,000 jobs. So and what's the difference between the federal dollars that we spend for health care and the federal dollars that we spend for defense? We have 30,000 federal jobs in Alabama that are associated with the federal employees in NASA and in the defense industry. And these are going to provide 30,000 jobs too. So it's an equivalent industry. And we don't have to give away $396 million out of our education trust fund to fund a plant down in Mobile that provides 200 jobs.
Amen.
That's a very important point if Mercedes was good for Alabama, and those dollars go to Germany, and if Airbus is good for Alabama, and lots of those dollars go to France, Medicaid expansion is better for Alabama, and all the money stays here.
Amen.